2022.
It is the voice of Indiana County. It's WCCS 101.1 FM and AM 1160. Our conversation with Dena Diehl today, brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. It's not that we only want to see you during Breast Cancer Awareness Month, but we do get to see you then. Good morning.
Good morning.
It's good to have you back with us here today.
Nice to be back again.
Well, we do. We visit every October with you and with the others at IRMC who are particularly interested in breast cancer. You're the nurse navigator at the Women's Imaging Center at IRMC.
Correct.
Yeah. So for folks who don't know, what does that mean?
So my job is to follow women from when they come to our center from their first suspicious diagnostic mammogram testing. I meet them then, and I follow them through their whole process when they're diagnosed, after their treatment, and then even like a year or so after to make sure they're doing okay. Mm-hmm. So it's a process, and I'm with them.
You're the one.
I'm the one.
You're the one that's there in their hip pocket through all of this.
Yes.
And it must be a great comfort to them to know that there's somebody there that's watching out for them and is really concerned for them. And
Yeah, it's a good resource.
It's very foreign to them to have to go through this.
Correct. Yeah, and educating them and being with them right at the beginning when it's the most stressful. It's nice to have somebody to guide them and keep them on track.
Absolutely. All right. So for Breast Cancer Awareness Month, we'll get into some of the numbers, of course, and what people should be doing in order to guard their breast health. But we do have some events that IRMC has coming up, including one on October 22nd.
Correct. So our Love of Life race is coming up next weekend, the 15th.
Oh, yeah.
So there's still time to sign up, and you can have a team. Just look at our IRMC website, and you can also call our foundation office to get scheduled. It's a great event, lots of people, and it's for a good cause.
Yeah, absolutely.
And then we're having this All About You 22. It's a brunch at Levity in the Loft. Dr. Clark, Dr. Bill Mori, and Dr. Margaret Clark are going to speak at this event. I guess there's going to be lots of food and prizes, so you can sign up as well on our website. And then we're having our Scaredy Cat Day Mammogram Marathon on the 26th. It's a Wednesday. You can call our scheduling center at 724-357-7075. It's from 7 a.m. to 4 p.m. We're going to have goodies and giveaways as well. So if you missed your mammogram this year, it's a good opportunity to get scheduled to come.
Yeah. And the Scaredy Cats thing is a bit lighthearted,
Yes.
but it also makes a point, doesn't it?
Right, yes.
Yeah, there are many people who, for some reason or another, and in a lot of cases it's fear, they don't do it. They don't get
That's
their
right.
mammogram when they should.
And it's one of the easiest tests I've ever had. So, yeah.
Easy to pass this test.
It is.
Yeah.
So don't be afraid.
Yeah, so for all of those events, of course, there's plenty of information available. Do want to point out for the You Are the One in 2022 event at Levity, limited space available, so it's absolutely essential that if you want to go, you need to RSVP.
Correct.
Yeah, okay, very good. All right, so let's talk a little bit about mammograms, why they're so important, who should be having mammograms, all of these things, because sometimes the information changes, sometimes they update it and say, well, we had said before this age range or this factor or another. Bottom line is women need to be getting their mammograms.
Correct. Especially women 40 and over. They should be coming in yearly. And also women who have high risk with, like, if they have a mom that's had breast cancer or a grandma, it's very important that they get in as well, especially the younger ladies. We're seeing them younger as their mothers or grandmothers have it younger, so you need to get in and be assessed as well. It may not be a mammogram, but at least have a breast exam and be seen.
Yeah. Mammograms themselves, the technology is amazing.
Yes.
And it is ever-changing, and IRMC is right at the top of the list when it comes to 3D mammography.
Correct, and they're catching a lot more tiny cancers that you couldn't even, like a normal human could see. It's amazing what they're finding, and it just goes to show the earlier you come, the easier it is to find and the better treatment you're going to have.
So when you do get an early diagnosis, and the 3D mammography helps that, the 3D mammogram that you get can help you find it earlier than probably ever before.
Correct.
I'm assuming then the protocol for treating it changes.
I think your outcome for treatment, a lot of ladies don't have to have the chemo and most do have radiation still, but your outcome and chance of survival is great,
Yeah. Yeah. The earlier you catch it and this thing, because of the way that it layers,
Correct. Yeah.
then see, I learn a little bit through,
That's good.
through these
You should come work with us.
But ladies have to get this done. And it's easier than ever because IRMC has more than one place where you can get it.
We do. We have our Chestnut Ridge in Blairsville, and eventually we're going to have 3D in Northern Cambria. It's down the road, but it's in process. So, I mean, we're going to outlie the area, so it's going to be easier just to get in both, 3 locations. So that's great.
Yeah. Now, for the average mammogram, when you have that appointment, okay, you call, you make your appointment. I'm going to go get my mammogram now. I'm finally going to do it. Talk about how that happens. Is it? You said it's not a painful procedure. What's the time frame? How long is it going to take? What is someone going to experience when they go for that first mammogram?
So we have wonderful mammogram techs. So you're going to be greeted with a wonderful experience to begin with. You're maybe there 15 minutes tops. They do compress your breasts and take a few pictures. They do like different angles just to make sure they can see it all. That's probably the worst is the compression, but it's pretty quick. It's maybe 15 minutes the most. They're in and out fast, and our ladies are great. They're experienced, and they make the experience a great experience. They try to get you over your fear, and it's a warm environment, and yes. Yeah.
So then that's something that you needn't be afraid of.
Correct.
Scaredy cats.
Because it could be worse. I mean, going through this test once a year is better than having to go through 6-8 months of treatment. So.
Yeah. If you do not get this done and breast cancer does develop, the odds are it's going to be much later in the process and then much more difficult to deal with.
Correct. Yes.
All right. So as it does progress in a woman, that's where you step in and you are able to help them through the various processes that must happen in their treatment. And it is a long road for a lot of people, isn't it?
It is, yes. And it's stressful, and there's a lot that they go through, and they're overwhelmed with appointments and, a lot of information. So it is tough, but we have a great team that provides great care, and they're all caring, and it's a wonderful place if you have to go through it.
Yeah, well, that being the case, people need to know that the survival rate for breast cancer is much improved.
Yes.
And it's because of things like 3D mammography, and it's because of the new treatment protocols. Dr. Clark and now Dr. Margaret Clark.
Yes, she has been a wonderful addition to us. She's great, and the ladies, the patients, they love her, and it's just a great addition to us.
And Dr. Billamoria, who we'll meet again, she'll come in and visit with us, isn't she?
Yes.
It's a terrific team approach at IRMC, isn't it?
It is. It is, and I don't think there's anybody that's not caring or nice, I mean, and when you're going through going through having breast cancer, you need to have somebody to be on your side and, caring.
I'll probably get the terms wrong, but someone who has a lump removed, a lumpectomy,
Correct.
As opposed to a mastectomy, obviously one is more difficult to deal with than the other.
The mastectomy, there's a longer recovery rate, and there's more involved. Most of our ladies, they do have lumpectomies now, and that's another thing. The recovery is much quicker.
Yeah. There was a phenomenon a few years ago of women who had a history or a family history of breast cancer who were automatically going and getting mastectomies. It's not really recommended.
No. I think mastectomies are the last choice. They want to try and preserve your breast and, cosmetics and for the ladies. But it's not promoted much anymore.
Yeah, less invasive, the better.
Correct. Yes.
Yeah. When someone, you mentioned as someone goes through the process of treatment, whether they've had the lumpectomy or just radiation or the mastectomy, and you take them through that process with what you do, dealing with them directly. Again, we're talking with Dena Diehl this morning, Nurse Navigator at IRMC. As those steps go through and they reach milestones, I'm sure that makes everybody feel better, you included. But when is a woman, I don't want to say in the clear, But when is she going to feel confident that she can beat this thing? I know it's different for everybody.
I think once you get through that radiation process, because that's the last and final step, mostly for most ladies, before they're done. I think that's the biggest thing is getting through radiation.
Yeah.
Yeah.
Yeah. But then the follow-up care
Continues,
and the
yes.
monitoring that must take place.
And it's important to go to those appointments and stay because, we do have reoccurrences, but it is very important to be compliant and stick to it. I think you get tired of having to go to them all the time, but it is important to still, follow up and have your mammograms and see those doctors. And
Yeah. Okay. So whether they're making a regular appointment for a mammogram, and they've been doing the right thing all along, or maybe they've been putting it off for way too long and they want to go to the Scaredy Cat event, what's the number that the folks should call?
724-357-7075. And we're booked till like the middle of December right now for screening mammograms. We just have been so busy since COVID. So just please call, don't put it off. And you don't need an order from your physician. It's covered with your insurance. So
That's
call.
interesting you say that too, because we heard about when COVID came in, people started putting off tests like that.
Yeah.
Have you noted since then that the incidence of breast cancer has gone up, or have we been fortunate enough to dodge that?
We're busy. I can't say it's slowed down any. Our numbers, they're pretty steady, but we just don't seem to be getting caught up with mammograms. So I don't know if that's because they put them off so long or if there's that many people. I don't know.
The message is getting out there.
I guess so, yeah.
Yeah. People are starting to get the idea that this is something I need to do.
Yeah.
It's not only for your health, but it's for your family's peace of mind as well.
That's right.
Dena, thanks so much for coming in to visit with us.
Thanks for having me.
We're glad you came. Again, Love of Life is next weekend.
Saturday on the 15th. And then our brunch is on the 22nd at Levity. And then the 26th is our Scaredy Cat Day.
There you go. There you go. Thanks so much.
Thank you.
It is the voice of Indiana County. It's WCCS 101.1 FM and AM 1160. Coming up in our next half hour here on Indiana in the Morning, we've got a visit with Lisa Spencer from the Indiana County Department of Human Services. Coming up in a second or so, it's Mr.